Recording in progress. Hi, everyone. I'm just giving a bit of time for connection to audio and just getting everything organized. Also giving a couple of minutes for the last minute people to join us. Thank you so much for taking time out of your evening to be here with us tonight. Should have some like fun music playing in the background for the beginning of our workshops.
Or a trivia game.
Or a trivia game.
Like when we used to be able to go to movies and it would have a trivia game up when you're waiting.
Oh, somebody help me. Time play. We should have a time play for before our workshops. No problem. So I'm gonna see what time it is. Oops. We'll give 2 more minutes for people to join us, and if you have any questions or anything, please feel free to put it in the chat. I think we're going to get started just because. So welcome, everybody. Thank you for joining us. And, you know, this is our monthly Meet the Team. We have these workshops once a month where we talk about all sorts of different topics. And today we are doing safety. So I'm really excited about this topic today. We have some really great speakers, and we're going to learn a lot. So I hope you have strapped on your seatbelt. But this is being recorded so that you will be able to take a look at it afterwards. Your screen does not show throughout the presentation unless you speak. So don't worry about that. It's just the slideshow and the speaker. So my name is Christy Clements. I am one of the owners of Helping Hands, and you'll notice my name says Doula of Doulas, and that is because my role at Helping Hands is to support the doulas. So those doulas that are helping all of the families that we support, they need the support too. And so I'm there to kind of be their cheerleaders so that they can be your cheerleaders. So my partner Jessica is also here. She is in charge of the slideshow today. And just a couple of housekeeping tips. Again, if you have your mic on, you will not be seen, but if you turn your mic off and there's some background noise, your screen will show up. So just keep that in mind. We also are going to be taking some questions at the end. So please feel free in the chat whenever you have a question, just type it in there. And at the end, we will answer any of those things. Also, I know a lot of people are eating and things like that. So if you want to have your camera off, that's fine. But we also love to see your faces as well. So the agenda for today is we're going to start off with some infant safety. So what are some things that you need to know about your home and really keeping your baby safe? Then we are going to be talking about safe formula preparation. So this is a really important topic and something that a lot of people don't spend time learning. So we're going to be talking about that. The next thing that we're going to be talking about is safe co-sleeping practices. So, we don't always plan to co-sleep with our babies, but if we are going to, we want to make sure that it is safe. As I mentioned, there will be a question and answer period where you can jump in and ask your question, or if you would like to put your question in the chat, we will answer those questions then. Then comes my favorite part of the whole time tonight. So after the question and answer, that kind of finishes our workshop portion. But then we have almost like a team doula speed dating that we have, where we will break out into breakout rooms, and you can have 5 or 10 minutes with team members to get to know them. So in order for me to plan for that, if you would like to stay for the breakout room session, if you could send a message in the group chat, in that chat box, you can send it to me directly, or you can send it to reply all, just so that I can put you on the list, and that way I can figure out how long each person will have. And if you're here for the workshop and then plan to head out, that's fine too. We just won't put you in the rotation with the speed dating. So that's what we have planned today. And so our first speaker is Janessa Crooks. So Janessa has a passion for health and safety. So when I say a passion, it is extreme. She is so passionate about people being safe and being aware of things that, can cause problems for children in particular. She also, her favorite thing to do in her spare time, when she has spare time, which she is a very busy lady, but she loves to spend time with family. She also loves sushi, and her favorite quote is, "You have brains in your head, you have feet in your shoes, you can steer yourself any direction you choose." And that is Dr. Seuss. And fun fact, Janessa is also my sister-in-law. So I get to be that family that gets to spend time with her when she has spare time, which is not too often. Anyways, Janessa, take it away. I can't wait to hear what you have to tell us about safety in the home.
Thank you, Christy, and thank you for everyone for having me tonight. So again, my name is Janessa, and I'm an owner of a company named Crooks Safety and Security Solutions. However, the last few years, I've had the absolute pleasure of partnering with Helping Hands Doula, and creating this class where I come into homes of expecting parents, or parents who have just had, their first or even sometimes their second child, and going some safety things in the home and common concerns that especially new families have when dealing with infants, and how to deal with the common things like bumps and bruises, and so the more extreme things that new parents are really concerned about, such as choking and burns and leading causes of injuries in the home. A little tiny bit about my background is, as Christy said, I've been working in health and safety for 17 years, so a very long time. And it is a passion of mine. I love going into people's homes, but really getting to know their families and getting to know what their needs are, and creating specific workshops for those families to meet their needs of what they want to learn. So, and again, I am Christy's sister-in-law, and I got this idea to do these in-home classes after actually Helping Hands was my doula for my first child. And it was amazing. And then I kind of said, it would be great if people who didn't have all the knowledge that I have had an opportunity to learn these safety factors within their home when bringing home baby. So that's led me to where I am today. So talk a little bit about safety in the home. So home should always be a safe place for our family, especially when we're bringing home new baby. But we as parents, adults, or caregivers, we have some work to do. We have some homework to do, and we have some, precautionary things we can do in the home to make sure that that place is super safe for new baby. So we want to educate your children and yourselves on hazards of the home and be realistic but not threatening. So in that aspect, as children get older, I'll refer to my family. My daughter's just over 3 now. So she understands that the stove is hot. Okay. She's not scared of it, but she understands that that is something that we have to take caution of. She knows that doors slam and doors can get your fingers caught, and that can be an ouchie. So it's really having those open lines of communication within the family and within your children as they're developing into these little people, that things can hurt you and it's okay to experiment, but take a step back and have a thought about it first to make sure that we're safe in the home. And prevention is key. So I'll talk a little bit about that today as I touch on some different topics. Sometimes when I also go into families' homes, they want to ask about outlet covers or baby gates and things like that. And a lot of that's a personal choice, but it's definitely something that I love to discuss with families. And a big thing for prevention is making sure that your home, especially when new baby's coming home, is clear of clutter. We have rug awareness, so we're making sure everything's kind of tapered down that needs to be. Stair awareness, we have lots of stairs. Do we need baby gates? Product storage, making sure that any chemicals we have are stored up high. I know a lot of, I forgot about that when I first brought home my daughters. Oh, she's not moving yet, but before blink of an eye, they're crawling and they're getting into everything. So making sure that those chemicals from under the sink are really going up top. Smoke and carbon monoxide detectors. So really simple trick with that is twice a year when it's daylight saving times, we change those batteries. We get in the habit of doing these safe practices in our home. And then it will become second nature. And monitor your children. And we'll talk about that more when it comes to choking, because really when we start introducing solid foods is when people really start to get that fear of choking. So I'll get into a little bit more specifics as we go through it at this point. So some statistics. So the leading cause of injury in the home for children are burns, poisoning, falls, and choking. So that's what I'm addressing today. Again, this is very kind of broad, but just to bring a little bit of education to your lives and safety today. You can go to the next one. So almost 30% of all home injuries in relation to children are caused by burns or scalds. So again, it's a lot about prevention, which I'll talk about when we get to the burn section. In all child-related poisonings in 2017, 65.5% were observed in the home. So most poisonings do happen in the home. When I speak of poisonings, it doesn't mean that it's absolutely life-threatening, but it's a substance in the body that your body cannot handle. And we'll talk about that in the poisoning section. And almost 2,000 children in a year in Canada suffer from fatalities related to in-home falls. So I'll speak a little bit about what is considered a significant fall and really when we can take care of it in the home and when we need to seek medical attention. And over 1,200 children each and every year have to seek medical care due to choking. In my experience, teaching these in-home classes, choking is absolutely the number one concern for families, especially when they're introducing food. So I'm going to get into a little bit of the specifics about this now. So these pictures are actually my daughter. She's a bit older than this now, so I like to jazz it up with some humor and show off my baby. So burns are the leading cause in the home. So burns are injuries to the skin or other tissues that are caused by basically 4 different things. So we have heat burns. So we've all had a heat burn where we touch a hot element or touch a hot stove. Chemical burns, for instance, if you splash some bleach on yourself, that can give you a chemical burn. Electrical burns, kids love outlets. And we've all probably seen those little outlet covers. And as soon as they start crawling and being able to manipulate little tools in their hands, well, now they're going to put 1 and 2 together, and that can cause an electrical burn. So we really want to be making sure that we're preventing any of that from happening. And radiation burns, the most common type of radiation burn is a sunburn. We've had a really hot spring so far. Hopefully we're all outside a lot because there's not much else we can do right now. So we're out in the sun and we're taking advantage of the good weather, but we need to, you know, just keep an eye on radiation burns and how to treat that. So severity and complications of the burns include, you can just put the rest of the screen on for me. The depth of the burn, the amount of the surface burned, the part of the body, and the age or physical condition of the burn. So there's 3 different types of burns. There's first, second, and third degree burns. Most of us have had first degree burns, which is red sensitivity to the skin. A second degree burn is when it starts to blister. Most of us have had that as well. I'm going to talk about how to treat the different ones. And this blister acts as a protective layer over top of the burn. So we always want to try to not burst that blister. Then the third degree burn is actually when the skin gets charred and we have no feeling anymore. So when it comes to heat, electrical, or radiation burns, we treat them all the same. So for a burn in the home, regardless if it's first or second, so it's just that red or it started to blister, we're going to treat it the same. So we're going to submerge that burn in cool water. How long do we submerge that for? Well, until burning subsides. That's how long we're going to do that for. One thing that we don't want to do with the burn, especially if it's already starting to blister, is to put it under running water. The reason we don't want to put it under running water is that if it's starting to blister, the force of the running water can actually open up that blister and open up an opportunity for infection. So that blister acts as an insulator to keep the bad bacteria out. So that's what we want to do. Now, I'll just a little things I like to mention, because I get a lot of old wives' tales when I teach this class. When I was little and I got a burn, my mom used to put butter on it. I'm not sure where that came from. On burns, we don't want to put anything on it. We don't want to put burn cream. We don't want to put polysporin, nothing like that until the burning has subsided. And that goes for sunburns too. I see on vacation when I go and people are all red, you know, that they baked in the sun, and then they're smothering aloe vera all over themselves right after. What that does is it's like putting the lid of a pot on a boiling pot. It's keeping the heat in and it's keeping that cooking. So we need to make sure that that heat has escaped. Then we can apply those creams or those agents, and that really just promotes healing and prevention of infection and prevention of scarring. So it's a little bit about burns. So poisoning, don't worry, this was not poisonous, what she got into in this picture. One of my number one things I always recommend when we eventually do get into these back of the in-person meet the trainer, I give out these magnets that have the poison control phone number on it. Poison control phone number is different for every province. So this is the Ontario one, and you can just Google it. But it's really important to have at the tip of your hand. So any substance that can be harmful to the body is known as a poison. Yeah, you just put the whole thing. So serious illness or death can result in a poisoning. They commonly involve unsupervised children and children who are experimenting. So adults are frequently casualties of medication errors or drug overdoses, but usually it's children who are experimenting. As adults, we learn and we grow, and you know, our teachers and our parents and our caregivers teach us what we should and should not eat and we shouldn't drink. And kids, if they're left unsupervised, you know, they test the limits, and that's also part of the fun part of seeing them grow up. So routes that poisons can enter the body is ingested, so by the mouth. So something I spoke about is those chemicals. Okay, so for instance, if your child were to get a hold of a chemical or a cream or something and ingest it, what do we do? In this picture of my daughter, she got into, it was like a bum rash cream. Completely non-toxic, but I wasn't sure myself, and especially it was my, you know, she was young then, and I was, even though I've been doing this, I second guessed myself. So what we do with most poisons is we call poison control. You can call 911, but what 911 does is it reroutes you to poison control. So we're just cutting out the middleman at this point. With poison control, you can tell them the name of the chemical, say they ingested or that spilt on them, because we'll talk about that in a moment. Or you can actually read them the barcode number. So barcodes are universal price codes, and they're universal. So they can type in that number and tell you exactly how to deal with it. So again, old wives' tales with ingesting something would have been drink milk, drink water, induce vomiting. Now it's different for different types of chemicals. Some things it'll say just monitor. Some things it'll say seek attention. Some it'll say do not induce vomiting, because often inducing vomiting can cause more stress and more injury to the esophagus when it comes back up. And then some poisons could be counteractive with water, so you might not want them to drink water. So poison control is your best friend. Inhaled poisons in the home, most common is carbon monoxide. So I spoke about the prevention of that, making sure that we're checking that on daylight savings time, that we're changing our carbon monoxide detector and it's always up to date. But it could be smoke, it could be a chemical you're cleaning with. Some people are very sensitive, right? So with inhaled substances, you just want to make sure you get out into fresh air. If the symptoms persist, so there's breathing difficulties, because this has to do with your lungs and your breathing, and can lead to cardiovascular injuries. If you're out in fresh air and your child is, and they're still continuing to cough, you want to seek medical attention right away. Absorbed poisons can be anything from a chemical to, for instance, a poison ivy. You're going on a hike, right? So with absorbed, you need to call poison control, because a powder chemical, you might not necessarily want to put water on because it could counteract with that dry chemical. However, with something like poison ivy, they'd advise you to flush it out. So you call poison control. And injected is entered through the bloodstream. So we're not talking about children and drugs here. We're talking about, snake bites, which we only have one venomous snake in Ontario, which is the Massasauga rattler, but also mosquitoes. Mosquitoes actually inject you with a little bit of a numbing agent before they suck the blood out. And, we've all met somebody who says mosquitoes don't like them. Then we meet people who get huge welts. So that's just the way that their body is reacting to a poison. So if you have any concerns, poison control is your number one go-to for poisons. But for the home, it's prevention. So bumps, no, good, sorry. So bumps, bruises, and falls. So most bumps and bruises can be solved with a hug, kiss, and a snack. Most kids, I love, this is gonna sound very awkward, but I love treating children as my casualties or my customer when they're injured, because children are easily distractible. If they're not seriously hurt, my daughter, a popsicle, like she was excited to get her booster shots because she got a popsicle after, right? It's not that easy when they get a little bit older. But bumps and bruises. So with bumps and bruises, you want to hold a cool compress to the skin after an injury. This reduces pain and limits swelling. However, one of the things that a lot of people don't realize, and it's kind of an old wives' tale as well, is that you don't want to leave that cool compress on for half an hour, 40 minutes, an hour, because we need to alternate between warm and cold every 10 minutes. So the analogy I like to give of this is, I'm a sports fan. So whoever is a sports fan, when a pitcher finishes pitching in a baseball game, they will ice their arm, then they go in a hot tub. And what that does is the cool constricts the blood vessels and limits the bruising and the swelling. But then we need to warm that up and open the blood vessels again to get the oxygen going through to promote recovery. So it's a recovery process. So, and you can do that all day if it's, you roll your ankle, but make sure you're taking that cold compress off to promote that recovery. Reduce pain with child formula Tylenol. Just make sure you're reading the instructions, not giving too much. You can mix Tylenol and Advil, but make sure that you get that direction from a doctor or a walk-in clinic. And with children, whenever in doubt, go to a walk-in clinic. And if pain or swelling is persistent or they're having mobility issues, you want to consult your physician. There should be another part on this slide. So falls. So falls are considered a serious height. So I always ask my clients, what do you consider would be a significant fall? And people say, oh, off a ladder, 4 feet, 6 feet. Well, if you are only a foot tall, falling off a 2-foot ladder is significant. But if you're 6 feet tall, it's not significant falling off a ladder. So the rule of thumb is that if a child or an adult falls off a height greater, their height or greater, we are going to seek medical attention. So if an infant falls off a coffee table, onto a hard surface, we want to, just to be safe, go seek medical attention. That could be enough force to cause concussions or any other kind of head, neck, or spinal injuries. So it should be considered serious and always seek medical attention. And always watch for signs of concussions. So a few key things that I always like to hammer home when there's a fall or a possible head injury and they've smacked their head, okay? Now children, this is where it's a bit harder because especially if they're not talking, they can't tell you that they have a headache. They can't tell you where it hurts. So signs to look out for in especially infants is projectile vomiting. I'm not talking a little vomiting. I'm talking like The Exorcist vomiting, right? When it's projectile vomiting, that's a bad sign that there's a quite possibility of a head injury, okay? Also, any blood or fluid coming from the eyes, nose, or ears. Now, it could be a nosebleed because they hit their nose, but especially if there's clear fluid coming from any of your orifices on your face, that could be your cerebral liquid. So it's the liquid that goes in between your skull and your brain and acts as that padding. That's automatically a 911 call. Great, that's fine. So last but not least is choking. So choking is serious and can be very life-threatening, and time is of the essence. Effective breathing is defined as having a good supply of oxygen, an open and obstructed airway, intact chest wall, and at least one functioning lung. People can breathe effectively. Ineffective breathing occurs in the body when they're not getting enough oxygen to function. So when someone is actually choking, when we're talking about a medical emergency, they're unable to speak, cough, or make any noise. With an adult or a child, usually they have their hands at their throats. Even children will do this because they know that there's something wrong there. When you have a fully obstructed airway, your face will go white and the child's face will go white, and you will see this. They'll get what's called cyanosis, and it's blue forming around the lips and the eyes, and it comes very, very quick, and that means they're not getting any oxygen and they're not able to breathe. So this is a medical emergency. So I'll talk in a second about how to deal with that. But the number one thing with children is preventing it. So when they first start eating solid foods, making sure that we're cutting it up to a small size. The most common foods that children do choke on are hot dogs, carrots, grapes, strawberries. So things that are a big chunk. So you always want to make sure that it is smaller than the circumference of a hot dog. Use that as a reference, and make sure it's chopped up. And we're also, until they really, about 3.5 is when children develop the reflex to really cough up something when it's partially obstructing their airway. Before that, they don't really have that reflex, so they tend to suck it in. So really it's monitoring them, making sure that we are providing the safe food experience for them. However, if baby is choking, there's two things we're going to do. One is I will give it to the actual maneuver. It's called standing abdominal thrusts, and you can Google baby choking and abdominal thrusts. It's really hard to do over Zoom to demonstrate. You can Google that, and I'll provide a link also to Christy, and she can send that out. But the first thing we're going to do with an infant is literally hold them on a 45-degree angle, take the palm of your hand in between their shoulder blades, and smack. You don't want to smack as hard as you can, but what you're essentially trying to do is knock the air out of them. 8 out of 10 times, just holding them on a 45-degree angle and smacking, I'm going to stand up for a sec, 45-degree angle downwards because you're using gravity to help you, and holding them and smacking them with some force in between the shoulder blades. 8 out of 10 times, they will cough that up. Basically what it's doing is knocking the wind out of them. It's making the diaphragm empty of air, causing that to force through the lungs, causing that item out. So, but again, prevention is the number one. So I'll send a link to Christy and she can send that out with the video that demonstrates that maneuver. However, if you do choose this class with Christy with Helping Hands, in your package, we'd either do it virtually or in home. And I come and I teach you these maneuvers. I teach CPR and we go over all of this in depth. So this was just kind of a brief overview of what I find are major concerns with new parents and new babies. So thanks again for having me, guys. And yeah, if there's any questions, I'll be here for the rest of the seminar.
Thank you, Janessa. Wow, that's a lot of information. I know this and I'm still overwhelmed. So anyone who has questions, I highly recommend the session with Janessa. She surely knows her stuff. So thanks for all of that. And if you have any questions, please put them in the chat and we can address them later. So next we have our postpartum doula, Sarah, who believes every woman deserves to be supported and cared for after birth. I think that's something that we all share at Helping Hands, but for sure. And wants to help families not only survive, but thrive after becoming parents. And that's such an important thing. You know, we don't want to just get through it. We want to actually enjoy it because we can't get that time back, right? So Sarah, you're going to take us through safe formula preparation today. I'm excited to hear what you have to tell us.
Thank you, Christy, and hello to everybody else who's here tonight. So I'm going to start off with cleaning and sterilizing the bottles. So even before you have baby, you can do this step. And there's a couple different options how you can do this. And this is also for after you have baby and you're feeding them with the bottles, but this is always the first step, is cleaning and sterilizing. So you can use the dishwasher for this. What you're going to want to do is separate all the bottle parts. So depending on what kind of bottle you have, there's different caps, rings, valves, the lids. Take all those apart, and typically people put these on the top rack of the dishwasher, and there are little baskets that you can buy as well, or a little mesh bag or something to fit all of those tiny parts into. You just don't want those getting kind of sucked and clogged down below in the dishwasher filter. And then all you're going to do is remove all of the parts once the dishwasher is fully done and sanitized. And then you're going to dry them. There's a lot of bottle racks out there, which are great too. But over time, those even can kind of get moldy on the bottom. So you have to keep up for that. But you can also just use a classic paper towel. I love that one. And then that way you're keeping it really clean and sterile. And then every couple of days, you're just getting rid of that paper towel and keeping it a really clean surface. Or alternately, if you don't want to use paper products, you can just use a clean dish rag, but you want to just make sure that you're air drying them and not kind of drying them with a rag or towel or anything, because that way the bacteria from your hands or the cloth or whatever you're using is going to be contaminating the bottles. So that's just really important to remember to air dry. And that's with any kind of bottle washing. So if you don't have a dishwasher or you don't want to use your dishwasher, you can also just do hand washing. And for this one, you're going to start off by washing your own hands, following the same step again, separating all the bottle parts and rinsing any milk that's in them. And then you're going to want to have a dedicated washing basin or a bowl or just something that is just strictly for all of your bottle parts. You don't want to put these into the sink where your food and everything goes. There's too much bacteria and contamination that can happen there. So fill up that bowl with hot soapy water. There's special bottle washing soaps now. It's getting really fancy, so you can use one of those if you want. And now that your hands are clean as well, just use a bottle brush. Make sure you try to get in the nipples, all the little nooks and crannies. There's little tiny brushes that you can go in there with as well. And then after you've washed it all with hot soapy water, rinse with hot water, and then again, follow the same system for drying, either a bottle drying rack or a paper towel or a clean dish towel to air dry once again. And then at this point, you can also boil. So once you've washed, you can put all of this into a big pot, cover it with water and boil for 5 minutes. And then that will really sanitize the bottles, and you can use little tongs or whatever you have to kind of scoop out all the bottles or pour out the water and then dry them that way. But I will say, if you are doing the dishwashers step, you don't have to do the boiling because most of them have hot enough water that it's already sanitized. So you won't have to do that boiling step. All right, the next section is the different types of formula. So the first one is called ready to feed. So this is the only sterile option. And this one, you basically just open the cap and it's already prepared, all mixed for you. And you just pour that right into the bottle and you're ready to go. The second type is powdered formula. So that will come in kind of like a can and you'll lift off the lid. And then there's like a little metal ring that you pull off for freshness. And there's a scoop in there. So for this one, you want to make sure that you're washing your hands before you prepare, because as soon as you're opening the lid and picking up that scoop, there's a chance for bacteria to go into the tin. So make sure you want to wash your hands before this kind too. And then the third kind is called concentrate formula. So with this one, it's a liquid form, but it's concentrated. So I think it comes either in like a tin or sometimes like a plastic jar, can thing. And with this one, you typically mix equal parts of the concentrate, the liquid concentrate, and water. But for all of these, you're going to be following the whatever the manufacturers directions say. So yeah, just follow the directions there. So then now that you have your types of formula, you're ready to mix and heat. So for the water, you're going to want to boil the water and then cool it to room temperature. So some families use bottled water as well. Some people do use tap water, but the best practice is really to boil the water first so that we're making sure it's as sterile as possible. And then you're going to fill the desired amount of water into your bottle. Let's say you're using powdered formula, you're going to scoop in the formula, attach the nipple and whatever ring that you have, and make sure you put the lid on so that when you're shaking it or mixing it, you're not putting your fingers on the nipple, because that's what's going to go in the baby's mouth. So just to watch out for bacteria again there. And then when you're ready to heat, you can either put it in just a cup or a bowl of really hot water. There's a lot of fancy bottle warmers out there. So again, follow the bottle warmer instructions. Do not put it in the microwave is the one big no-no, because that is uneven heating. So there'll be some hot spots in the bottle. So that's definitely the one thing that you want to remember. Do not heat in the microwave. And one thing I will say is you don't have to warm up bottles as well. You can serve them with that room temperature water, and some babies will drink them like that, which may save you a hassle, but some babies also really just prefer it warm. But just a little note there that you don't have to heat them up. There are a couple little tips and tricks if you're going to be exclusively formula feeding. Let's say you're going into a nighttime. So you might want to pre-measure out all your bottles for that night, like the amount that you're going to need, let's say 2 ounces in all your bottles of that water that's already boiled, it's already ready to go. Or alternatively, you could mix a huge big pitcher of formula and have that in your fridge, and that's good to stay for 24 hours. So it's really up to if you're going to be using formula primarily or not, but you can definitely pre-make it or have everything kind of ready to go as well. And then when we're coming to storage, if you have that big pitcher, let's say that you've mixed in already, it's already prepared to go, that can stay in your fridge for 24 hours. And then if you've opened a can of, let's say, the concentrated formula, that can stay in your fridge for 48 hours. So with all of these, it's a really good idea to write down the date and the time that you did it so that you can keep track, because you're going to be confused when you're a new parent and you're like, when did we make that formula again? So yeah, in the fridge 24 hours. After you've mixed it, 2 hours at room temperature, and let's just say the baby doesn't drink it in that time, at that point you can put it in the fridge and that will be okay for 24 hours. And then once it's touched the baby's mouth, 1 hour. And so hopefully that visual kind of helps. And I'll give credit to the woman who made it. Her name on Instagram is The Formula Mom. So she's a really great resource as well for all things formula related. And then some common questions. So people ask, how often should I be cleaning my bottles? And the answer to that one is every single time that you use them, you need to be washing them with the hot soapy water. Now, sanitizing, that's a different story. So for sanitizing, once in a 24-hour period, is okay. And this is actually only really just primarily in the baby's first 3 months of life. After baby's 3 months old, if it's not, immunocompromised or there's no other issues going on with baby, then daily sanitizing is not really necessary. You can do it as you want to do it, but in the first newborn stage, or if you have a preemie, it's good to be doing the sanitizing once in a 24-hour period. Another common question is, can formula left over from a feed be refrigerated and used again? Let's just say your baby only took some of it. And the answer to that one is no. So again, after baby has had a sip of it, now their bacteria is on the bottle, and that can multiply, even if it's in the fridge. And if you're adding things onto it, another formula onto it, that's going to mix as well. And germs can grow quickly there. So no, you cannot use that one again. And then finally, how many bottles do I need? And this one's a bit tricky to answer. It's really up to each family and how you're going to be using bottles. So normally I would say experiment with a bottle before you buy a lot of them. And once you find one that works, if you find that you are going to be using bottles a lot or exclusively, then I would say get a lot. And by a lot, I mean 6 to 8 bottles or more, so that you're not constantly washing and doing this like all the time, because you're going to drive yourself crazy with just bottle washing. So I know a lot of formula feeding families that just go over the top and get tons, so that they just do one big wash a day, and they just, find a system that way. But yeah, that's all I have to share for today. Hope you enjoyed.
It helps to unmute. Thank you so much, Sarah. That was really, really important. And we did get some questions, so we'll chat about those during the question period. Again, any questions that you have throughout the presentation, please let us know and we can chat about them later. So next we have Heidi. Heidi is a postpartum doula on our team, and she loves walking her dog in the forest and believes strongly in the power of a mother's instinct. Heidi is going to talk about bed sharing safety, which is really important. So Heidi, I'm really excited for what you're going to be telling us. I'm excited about what everybody tells us, but and we'll just get you to unmute. There we go.
Hi, everybody. Oh, sorry.
Go ahead.
Okay, good evening, everybody. You've been getting some wonderful information. I'm taking notes. I'm learning so much. So I'm going to talk to you a little bit about bed sharing safety. And if this is also called co-sleeping, or some people call it the family bed. And if you don't know what that means or what it is, it's basically sleeping with your infant in your bed. And this is something that I think almost every new parent does at some point, because our babies sleep so well when they're snuggled up, warm, close to us. They can smell us and hear us, and that's where they feel safest. And we are so exhausted as new parents that often we'll fall asleep with our babies. But there are some concerns about this. And the big, what I need to say up front is that the Canadian and American pediatric societies do not recommend sleeping with your baby in the same bed. They recommend sharing the same room, but not a bed with baby, due to increased risk of SIDS, which is sudden infant death syndrome, and other concerns about suffocation. And so you can see that there's something, on one side, it's very instinctual. It makes total sense that babies love to be with their mom and dad, all cuddly, cozy, and warm, and we all sleep well. But there are some concerns in situations where it's just tragic that, common sense or, poor understanding of how to do this safely can cause terrible terrible consequences. So what I'd like to talk about is a little bit of the information that we can share around how to do this safely. So there's 7 sort of safe co-sleeping steps that are, well documented in research and peer-reviewed research, that these are things that help keep babies safe if they're sleeping with mom and dad. So the number one reason is, or thing that you need to remember is no drugs, no alcohol, no smoking in the home. So these have all been linked to increased risk of SIDS, but particularly anything that can, impair our alertness. So whether that's, medications that we take, and anybody in the bed needs to not be doing drugs, alcohol, or smoking. So a common sense step. Number 2 is breastfeeding. There's wonderful information to say that if mom is breastfeeding, she has a very strong, protective, and instinctual link to baby and will not roll on her baby. That being said, dads don't have that. So it will be up to dad to decide, whether he feels comfortable enough. Or there are ways that, maybe if you're going to position baby in the bed with you, you're going to position the baby between a safety railing and mom. And that's where baby would sleep in the bed. And this is not to say that if you're formula feeding your baby, you cannot sleep with your baby. It just means that you're not having quite as much of that natural protective awareness of your baby as a breastfeeding mother would. So it's just something to think about. And it's also, all these steps are really things for you to decide, is this something that will be right for me and my family? I think we're learning so much more information about being a parent is gray area, and that we all have to make our own decisions based on good information. And it will be different for each family. So I'm putting these steps out there as ways to help you make the decision of what will be right for you. Okay, so number 3 would be a healthy baby. You don't want to be sleeping with a baby that's unhealthy or is stuffed up or has special needs. We're going to follow the other guidelines about healthy sleep, which is putting baby to bed on its back, because we know that that also decreases the risk of SIDS. So healthy baby on their back, breastfeeding, no drugs and alcohol, lightly dressed. So babies also can overheat quickly. And particularly when they're snuggled up and warm, they don't need to be, swaddled or wrapped in a bunting blanket, because they're going to be getting your warmth and heat too. So lightly dressed, the way that you would feel comfortable, usually with one layer. Number 5 is really important. It's a firm bed. So this is sort of, I would say, what I've read is that most of the terrible tragedies that have happened with sleeping is the use of drugs and alcohol combined with an unsafe sleeping environment, meaning sleeping in a recliner or a sofa or a waterbed, that doesn't have good support and has places where baby could roll and suffocate. So really important to have just a flat surface, firm bed. And if you feel you're holding baby and you're on the sofa or you're on the recliner chair and you think you're going to doze off, maybe that's the time you get up and you go to your nice firm bed with your guardrail on the side and you have a nap with baby in a safe location. So that's, I think, probably it should have been number 2. I'm thinking number 1 is drugs and alcohol, and number 2 is a firm bed. All right, number 6 is watching for cords or gaps. So certainly, we're taking electronics to bed, and we have pushing up a bed against a wall isn't sufficient really to protect baby, because there's still always a gap or a space there which a baby could roll into. So you want to be using something that's designed to keep baby safe. There's, like a mesh guard on the edge of the bed that are probably the best. Or having the bassinets that move right up towards baby, where they have a little platform that attaches and makes it a connected zone. So again, all of these are common sense. And certainly the last, which we discussed earlier, was that the baby should be close to breastfeeding mom, and that no other children should be in the bed with mom and an infant, because the other children as well don't have that same protective instinct as mom does. So again, I'll just reiterate, this is something that happens to all new parents, and don't beat yourselves up about it. But again, if you think that you're getting sleepy with that baby in the recliner, just think about these steps. As well, when you have your new baby with you, when you're thinking about how to get the best sleep, there are ways, and wonderful ways, that this very natural, normal, nurturing kind of sleep can happen. But we do have to take some measures and make some good decisions about how we do it. So it was lovely to talk to you, and I look forward to meeting some of you later. Thanks.
Thank you, Heidi. I think what you said was so important, that we want to plan for this type of thing, because I think a lot of people don't expect to sleep with their babies, but then they just end up being so exhausted, and it's much better to create a safer environment than to fall asleep in the recliner, like you said. So we did have a couple of questions come through, and any of our doulas can jump in with this. But is an Instapot good to use for washing and sterilizing bottles? That's a good question.
I'll jump in. I've never seen anyone do it yet, but I would lean more towards no, just because you're cooking food in there, and I feel like it might get too hot. I don't know what the different settings are, but I'm just wondering if it may melt certain things. But I think that's basically up to, if you want to, you can, but I've never heard of it before.
So then we have.
I'm just going to add on that.
Yeah.
So I've never seen one either, Sarah, that someone's been able to successfully use their Instant Pot, but that is a really good point in terms of using it for food. In terms of midwifery and doctors throughout the ages, what's an Instant Pot actually called? It's can anyone pop in here and tell me what the actual apparatus?
A pressure cooker.
Pressure cooker, thank you. Pressure cookers are traditionally what we used to use to sterilize equipment, but they're only to sterilize equipment, so not going back and forth between food. So I just wanted to add that little 2 cents.
All right. And if we're using a dishwasher, do we have to do it separately, or can we mix our own dishes and stuff in there? Any dishwasher people want to jump in with that? Does it matter?
I'll jump in again. I haven't seen people mixing both of them. I think because of the same thing, the food, but I also think it's one of those things that it really comes down to the family. I maybe people would put all of the bottle stuff on the top, and then maybe your dish stuff on the bottom. I could see that being something that would work, but again, this is one of those things that kind of just goes down to your comfort level. So again, not really a clear answer. But
yeah. And sometimes old school works, right? Just get yourself a good brush and clean the bottles well, and then throw them into a pot once a day, and let them dry on a towel. And then the question about how many months do we need to sterilize bottles? Sarah, you jumped in there and said 3 months, which was what you had said earlier. Petra, who is our sleep consultant on the team, has put a great link in the chat for co-sleeping from Dr. James McKenna. So if you'd like to take a look at that. And is there any, there was also, what if I have a baby wrap carrier facing in or out while sleeping on a recliner? Is that safe or not? Would Heidi or Petra like to jump in with that, or any of the other doulas?
I'm not sure if Heidi's trying to get her on mute on.
Yeah.
There we go.
Yeah. Yeah. It's a good question, but my gut feeling would be that that would not be a safe option. Baby needs to be on a flat surface on their back. Like that's one of those safe sleep guidelines. And so you want to be on a firm surface where baby has room to breathe and move. Well, you're not aware to be able to watch them. You want them to be in a safe place.
Mhm. Petra, would you agree with that if you're going to
Yes,
use a
I-
rack, you probably should be awake?
Yes, absolutely. You don't want anything. You want your baby to be free and loose and be able to move around. And when one of the most important thing is that the airway is free. So if a baby is in a wrap or in a carrier, some babies fall to one side or forward or any way. So you really want to avoid that. So if you're walking with your baby in a carrier, that's something different. But if you are on a chair, in a chair, on a couch, no, you want your baby to be out.
Yeah. Same with the car seat, right? Like when the
Oh
car
yeah,
seat's
car
not
seat
in the
is
base,
yeah.
it tips forward.
We really have learned a lot over the containers that babies are sleeping in. You really don't. The car seat, the name is car seat. It's when your baby's in the car. As soon as you take your baby out of the car, you take your baby out of the car seat. You
Mhm.
don't want your baby to sleep in anything else than on a flat surface.
Yes, for sure. Awesome. I don't see any other questions that have come in. So we are going to go into our breakout room session. This is not recorded. These sessions are private. We have enough team members that there will be two team members in probably two team members in a room with those of you who said that you wanted to do the breakout rooms. If you missed that announcement earlier and you'd like to be put in a breakout room to get to know our team better, please let me know, and I can put you in as well. So if there's no other